Good afternoon, everyone, and welcome to our May Teach Educational Rounds. Here with us today, we have Stephanie Kersta, who will be presenting on cultivating self-compassion in clients after relapse. So we'll start off today with our CAMH land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase, Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that respect and reflect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So now's the time where I'll invite everyone to share which land that you're joining us from today. And if you don't know, I'll put the link in the chat right now that you can use to find out. And you're also welcome to share something that you're currently doing to learn or improve your ongoing commitment to reconciliation. So I'll give everyone a moment to do that, and then I'll just continue on with my own land acknowledgement. My name is Rachel. I am a second-generation Canadian located on the lands of the Mississaugas of the Credit, which is covered by Toronto Purchase Treaty Number 13. I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. So everyone can feel free to continue doing this while I'll just keep on going throughout the slides. And to start, I'm just going to highlight a couple of upcoming trainings that Teach will be offering. And the first of which is the Foundational Health Educator Workshop. You might have heard of this one before. It's offered annually, and it's our only in-person training. It's 2 days in person in Toronto, Ontario at the CAMH site. And this year it will be on September 18th and 19th. And so this training is a requirement for the Certified Tobacco Educator credential and the Certified Respiratory Educator credential. And both of these credentials are offered through the CNRC, which is the Canadian Network for Respiratory Care. So this is a great training for anyone who wants to get a better understanding of the essential competencies needed for tobacco prevention and cessation. And it's also a great opportunity to enhance your skills, gain evidence-based knowledge, and advance your career in tobacco education and care. And like I said, this one's a bit more unique where it's our only in-person training as of now. So if that's something that you think you would respond well to, or you're looking for those type of training opportunities through Teach, this would be a great fit for you. And the QR code is available on the screen for anyone who's interested in registering. I'll also put the registration link in the chat. But I know this one would require a bit more preparation than our other trainings, so feel free to reach out to teach@camh.ca if you have any questions on that. And our second training I want to highlight is our tobacco interventions for clients with mental illness and/or substance use disorders. And this training actually started today. It's a 3.5-hour online course, and it focuses on knowledge, skills, and abilities to provide a client-centered biopsychosocial approach to detect, screen, engage, and treat patients with a mental illness and/or substance use disorder focused around tobacco use. And this will be facilitated by Carolyn Platter, who's a social worker. She has facilitated a lot of our past Teach trainings, so she might sound familiar if you've taken a course in the past. And this course is running from today, May 14th to June 18th, but we're keeping registration open until May 16th, which is this Friday, for anyone who's interested in registering. And just a reminder, this one will be online and it will be through the Moodle like the rest of our courses. And the QR code is available as well for this one, but I'll put the link in the chat too, if anyone's interested in registering. And again, any questions at all, please feel free to reach out to us at teach@camh.ca. So now back to today, I will just go forward with a few reminders. And first is that if you're interested in receiving a letter of completion for this Teach Educational Rounds, to make sure that you first registered for this webinar and completed the full pre-learning assessment. Also that you sign into this webinar using your first and last name so we can identify you. And finally, to complete the evaluation and post-learning assessment, and both of those will be sent out at the end of the webinar. And you'll have a week to complete them. So a bit more on Stephanie. Stephanie Kersta holds an honors Bachelor of Science with a specialist in psychology and a Master's of Science in psychology as well. She holds a number of certifications, namely a postgraduate certificate in addictions and mental health counseling, and including advanced training in solution-focused therapy, cognitive behavioral therapy for insomnia, and psychometric assessments. As a complement to her strong clinical education, Stephanie has incorporated additional evidence-based holistic certificates to further round out her training, including certifications in 4 mindfulness and meditation clinical modalities. Stephanie holds teaching positions at multiple post-secondary institutions, and she has a clinical psychotherapy practice where she primarily treats anxiety, depression, self-esteem, and insomnia. So welcome, Steph. And I'll give you a moment to read through her disclosures. And this is just a note that all Teach Educational Rounds presenters are offered an honorarium. That being said, presentation content is not affected by acceptance of this honorarium. And the following content of Teach Educational Rounds is centered on evidence-based guidelines from the sources on this slide. However, these materials, as well as their verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So with that, I'll pass it off to you, Steph, to get started today.
Thank you so much, Rachel. So welcome everyone. Welcome. I hope you're having nicer weather where you are. I'm in Toronto and it's very gray and cloudy and not the nicest day today, but it's a very nice day to be online and talking about self-compassion because I think we all could use some self-compassion. So we're going to talk about cultivating self-compassion in clients after relapse. And so talking a lot about, how to be nice to ourselves after a slip, after a relapse or a lapse, and also just kind of throughout the tobacco cessation journey, because for a lot of people, stigma is a huge thing. There is such stigma around tobacco and smoking and, still continuing to have this addiction. And so, how do we help our clients to not internalize that stigma? I also find self-compassion is just a really helpful tool for clinicians in general because, the work that we do is difficult, right? And it can be upsetting. It can be really difficult and hard to see clients who continually struggle. Sometimes we can turn that inward. So why I like this topic in particular is because not only is it something that can be really supportive to our clients, but it's something that we can also use to be really supportive to ourselves as well. So I always love those 1-2 things that we can, learn from and maybe become better humans for ourselves while also supporting our clients. If you've ever done a webinar with me before, I love questions. I love conversation. And so, at any time, we will have some time for questions and more discussion at the end of the session. But at any time, if there's questions, comments, your own shares, your own things, your tips that you have done or things that you've done with clients that have gone over really well, please, please, please feel free to share them in the chat. I find it's just so much more fulsome when we can all kind of converse about this. So please feel free. Don't wait till the end. Just feel free to pop it in the chat. Anything at all, questions, comments, thoughts, and then your own tips and your own kind of experiences. I really value those. So the learning objectives were on the worksheet, but definitely, essentially what we're going to be talking about today is how we can talk about the core components of self-compassion and explain that relevance to tobacco cessation? How do we apply self-compassion techniques to help clients process feelings of shame, guilt, or self-criticism following a relapse or a lapse? And then talk about some of the barriers to self-compassion after relapse. And so we'll talk about the different strategies, and hopefully you'll leave with us with some really good strategies and tips and exercises that you can apply with your clients. So just overboard, what is self-compassion? Like I said earlier, there's three components of self-compassion. So self-kindness is one, and self-kindness really, what it is, it's refraining from criticizing ourselves for a mistake or a flaw, and instead being understanding and supportive of ourselves. And when we're in pain, we can recognize the harm of self-judgment, treat ourselves warmly and patiently instead. And really what self-kindness is recognizing our unconditional worth, even when we fall short of our own expectations. And I think that's a really powerful statement, because you know I work predominantly with young, like with adolescents and young adults, and I work with a lot of people who have very, very, very high expectations of themselves. So any mistake that they make, it feels catastrophic, and really just rips away at their self-esteem and their own self-worth. And what I like about self-kindness is, it's recognizing that even if we fall short of our own expectations, even if, a client goes to a party and ends up having, a smoke or a vape, they still recognize that they are a worthy human being. And that's a really big thing, especially for many clients who have been beaten down by either many different attempts, like quit attempts, but also, the stigma of healthcare providers, friends, family, well-meaning people. So both of those things can really, impact our own sense of self, our own worth. And so being able to still maintain that self-kindness, being able to maintain our sense of self, recognize that we are worthy humans, is a really powerful thing. Mindfulness is another one, and you'll hear me talk about mindfulness kind of throughout this, because there is a huge mindful component to self-compassion. So really, a lot of people feel that it's the first step towards self-compassion, and that when we combine mindfulness and self-compassion, what it does is it has like an additive effect. Because what it does is if we think about mindfulness in general, mindfulness is, purposefully paying attention to the current moment, right? And so being mindful, and you'll see as I go through many of the different activities, they're all mainly mindfulness based activities. What it does is it allows us to recognize distrust in ourselves while also encouraging emotional balance, especially in the face of, adversity, or in the face of triggers, or in difficult times. So mindfulness is essentially just allowing ourselves to slow down, come to the present moment, and really just take it step by step and recognize what's coming up for us. Common humanity is also another one, and it's just recognizing that, the broader, we're not alone in the human experience, right? So not seeing ourselves as isolated or separate from others, but it's more so recognizing that we are part of that broader human experience. And so when we feel imperfect or hurt or lonely, remembering that we're not the only ones that maybe have felt that way. And so the idea behind that is to, instead of withdrawing or isolating ourselves, really focusing on common humanity, recognizing that connection with others, recognizing that other people may feel this way as well. So using that as a tool for connection with others. So instead of an isolating kind of the natural impact is to, or the natural inclination is to kind of isolate ourselves because we don't feel good enough, we don't feel, we feel hurt, we feel lonely. Instead of pulling away, recognizing that we're not alone in this, is looking at ways to connect with others. So pushing us towards connection instead of pulling us away. If there's any questions about that, just let me know. And so why are we talking about self-compassion, right? Why is it important? Relapse, again, many of us know it's a very common part of tobacco cessation. And because it's kind of like, it's the norm, right? It's an expectation. I oftentimes will say to my client, like, relapse, like when we talk through, a cessation protocol, or cutting down, I'm always saying relapse is part of the process. Relapse is part of the process. If you come to me and tell me I'm never going to relapse, or if you never say to me that you've relapsed before, you've never had a slip, I kind of would think that you're maybe not telling me the truth, because it is such a common thing. So many people, it's an expectation, not an exception. And so even despite all of that, relapse brings shame, guilt, self-criticism, right? How many people have you worked with? How many clients, your own, if you've ever, smoked before, your own cessation? How many times do we feel embarrassed and guilty and feel bad? Maybe we don't want to go back to our clinician because, we feel like we're going to let them down. So big, big emotions that come from relapse. Those big emotions can impact our motivation. If you think about, the stages of change, oftentimes when you see the stages of change, relapse can happen anywhere. And what we know with stages of change is that even though it can happen anywhere, when you get back into that cycle or that stage of change, you can come back at any other stage, right? So it can, and it very much often does, push people back, right? So if someone was in action step, maybe they're now going back to like preparation or contemplation, right? So these emotions that come up from relapse absolutely can impact our motivation, absolutely make us maybe not want to try again, right? What we know and what the literature tells us is that self-compassion helps people recover from setbacks, reduces stress, and supports long-term change. Because if you think about that mindfulness piece, right? It's twofold. Recognizing that those emotions are coming up around relapse can allow us to interact with them or intervene earlier before they set us back, before we hold them. Also, it moves us, that common humanity piece moves us towards connection. So instead of, again, hiding away because we feel like we're a terrible person and, we don't deserve to go back to, the stop on the road, what it does is it's like, okay, you know what? Other people maybe feel this way. I don't have to feel like I have to go into hiding. I don't have to feel like I'm alone in this. So it's recognizing that you're not alone in that. And recognizing that those emotions do come up. And we'll talk about other ways that we can deal with that. We also know, like I said earlier, smoking related stigma is damaging, right? So that stigma, it's twofold, right? So when someone is actively smoking, there's absolutely a lot of stigma on that. Troubles with cessation, absolutely stigma with that. So there's a lot of stigma that comes from every direction, really, for a lot of people. And so that can also impact quitting, because also then it's like, well, if I'm going to quit, then there's that fear of failure for a lot of people as well. And so stigma is a really big thing. We also know, what the literature has told us, is that stigma can lead to medical treatment avoidance. And so one of the questions that was submitted earlier was, how can stigma impact people's quit attempts? Absolutely, it can lead to medical treatment avoidance. It leads to a negative impact on our own self-esteem, self-efficacy, seeing that it can really bring us very far back after a relapse. But more so because we're seeing that medical treatment avoidance, that's why people think cold turkey is the way to go. That's why people are doing cold turkey, because it's the number one, it still is the number one cessation attempt. And it's because, there is that medical treatment avoidance. There is that not wanting to go get help. There is not wanting to go, tell people that you're smoking 2 packs a day instead of, one. And so absolutely, we're seeing that people are going without the supports that we know really are helpful, because there is that stigma, and because they are worried about being stigmatized in general. So, thinking about the role of self-compassion after relapse. So, if someone relapses and recognizing, what comes up. So the first one is to really avoiding that shame spiral, because a lot of people tend to fall into that shame spiral, right? They'll start to think of like, I'm a terrible person, I couldn't even do this, and then it goes down and down, and they're really kind of negative about themselves. Maybe they just decided, forget all of this, I'm going to go back to smoking, I'm never going to be able to do this, like I'm a failure, all of those not so nice things. So what's really helpful in that shame spiral is to a couple different things, but the first one is urge, like how we urge surf. I think many people are aware of kind of the urge surfing with cravings and triggers, but you want to surf the emotion. And so essentially what I oftentimes will tell clients is any emotion. What goes up must come down. So any emotion that we have, emotions are fleeting. Emotions are also emotions. They're not facts. They're not grounded in anything. They're just feelings, and feelings are valid, right? We can feel certain ways, but it doesn't mean that they're factual. So if I feel really disappointed in myself, it doesn't mean that I should be disappointed in myself. If I feel like I'm, a failure, it doesn't necessarily mean that. That's not the fact, it's a feeling. So feelings are not facts. So the first thing you want to do is just recognize that emotions come and emotions go. So just like if you imagine a wave, right? We're going to have these emotions, and just notice when we're surfing is you just want to feel the wave. So you want to recognize, what are these emotions that I'm feeling? Approach it with a bit of curiosity, right? Notice how it surges, notice how it gets stronger, but then also notice that it's starting to dissipate a little bit. And so by so many of us, we've looked at emotions, and we've labeled emotions as good emotions or bad emotions, right? So many of us feel that there's either good emotions or bad emotions. So like happy, excited, loved. I don't think loved is emotion, but you can feel loved. Happy, excited, feeling good about yourself, all of those, confident, they're all emotions that we consider good. Sad, mad, bad, those are all considered those kind of bad emotions. Anger, but emotions are emotions, right? Emotions are just feelings. And so what happens is, because we've labeled so many of these emotions throughout our life, we try to push away the bad ones. Anxiety, depression, worried thoughts, all of that. It's like our brain's like, oh no, we don't want that. So I'm going to try and push these away. That's where you see some of those maladaptive coping skills that can come from that. By looking at, emotions are emotions, by being accepting of emotions, it's not great, right? Like no one's like, oh, you want me to feel bad? No, I don't necessarily want you to feel bad, but allow yourself to feel what you're feeling. The kicker with that, though, or kind of the caveat with that, is you have to keep remembering that feelings are not facts, because a lot of people have that, that cognitive distortion that if I feel a certain way, obviously I am. It's not. It's a feeling, right? I can feel, I don't know, I can feel like I'm going to win the lottery tomorrow. It doesn't necessarily mean that I'm going to. And so feelings are not facts. So while you're surfing the emotion, you want to keep remembering that feelings are not facts, but they're feelings, and we don't necessarily need to push them away. So we don't need to numb out with alcohol. We don't need to, numb out with vaping or cigarettes or cannabis. We just want to allow ourselves to feel and keep remembering that what comes up will go down, right? Just like a wave, it's going to surge, but then it's also going to get back to calm waters. The other thing that I really like is any type of grounding activity. And grounding activities are essentially just bringing ourselves into the present moment. And so I like to think of grounding activities as little, little mini, they are mindfulness in general, but they're really good kind of distractions, right? So my favorite one is the 5 4 3 2 1. So there's a couple ways you can do that one. So some people do one of each kind of sense. So you could do like 5 things you see, 4 things you hear, 3 things you smell, 2 things you touch, 1 thing you taste. Or if you want to do it a little bit more, you could do like 5 things you hear, 5 things you see, 5 things you smell, 4 things you hear, see, and smell, 3 things you hear, see, and smell, and so on and so forth. So you can make it longer or not so long, a quick and easy one. Another grounding activity that I really like is just picking a color, just pick an obscure color and name everything. So it's kind of like adult I spy, but name everything that you see in that room in that color. So if I pick the color green, it's not very obscure because I have a lot of green, but the plant, the other plant, the other plant, all of the plants. So, we can, just picking a color and just looking for that color. I love a mindful walk or a mindful gaze. So you can go for a walk and you're just noticing everything you see. So, and in your mind, you're just kind of, stating everything you're seeing. So, man in red shirt, white dog, blue car, whatever, so on and so forth. So, all of those grounding activities, essentially what they do is they just get us out of that spiral. So it's a little bit of breathing room, to help us just kind of kick out of that spiral. Because it can be, when we get into that kind of brooding spiral, it can be really difficult. And so, anything we can do to just kind of distract ourselves from that can be really powerful. Another one is writing a compassionate letter to yourself. So write a letter to yourself, and we'll talk about different ways of looking at this, but a big one is how would you look at it? Like, how would you talk to a friend about this, right? What would you say to a friend that was in this situation? Write that letter to your friend, but that friend is yourself. So, really embodying that, recognition of common humanity, of that self-kindness, of, being in the present moment, and then absolutely talking about it, which again brings that sense of connection. So that's the shame spiral. I know that was a question, so I just wanted to touch on that. But also, if we think about self-compassion after relapse, we're seeing that it reduces shame and guilt. It can increase self-regulation. So those who practice self-compassion are more able to tolerate cravings and distress, which reduces likelihood of future relapses. And I wonder if anyone, knowing now kind of what what what's part of self-compassion, if you think about that mindfulness, if you think about that, emotional awareness, if you think about, the connection with distress, can anyone recognize, or can anyone say, why do you think self-compassion, people who are more self-compassionate are able to tolerate cravings and distress? Any ideas why that's the case? It also promotes resiliency. So, it helps us to re-engage with our quit plan and help to sustain efforts over time. Resiliency, again, it's a way to be able to recognize our own internal strength. And so being self-compassionate can absolutely help to promote resiliency. High resilient people also, they better manage stress. They also better manage kind of slips, but more so, they also have healthier coping strategies. So then you're seeing that if someone is building their resiliency, if they are more resilient, they, are less likely to fall into those negative or those kind of maladaptive coping mechanisms. I'm just looking at all of these. Yeah, part of being human is what I'm thinking. The avoidance of secondary emotions. Absolutely, Elizabeth. And yeah, Emily, the antidote to shame. Absolutely. Yeah. And again, thinking about mindfulness in general, if you look at the literature behind mindfulness, mindfulness helps with emotional regulation, right? So when we're able to recognize that those early triggers that we're being that we're being triggered, that we are in distress, we're better able to name them, recognize them, and work with them before they get too loud and too destructive. So lots of good that comes from, being kind to ourselves. There's also this concept, and again, this was another question that was submitted, but how can we apply a growth mindset with self-compassion? And truly, it's a winning duo, it's a winning pair. So if you think about growth mindset is reframing setbacks, focusing on our efforts, being persistent. Pairing that with self-compassion, so that acknowledgement of feelings, positive self-talk, self-forgiveness, kindness, and understanding, especially towards ourselves, helps overall to reduce self-criticism, enhance motivation, promote resilience, and facilitates long-term recovery. So absolutely using those two together can be really powerful. Because I think, what comes from that is, number one, with relapse, is we're really avoiding that shame spiral. So we're starting to be really kind to ourselves. We're recognizing that it's a norm. We're recognizing the feelings that come up. We're forgiving ourselves. We're talking to ourselves kindly. But then also now we're looking at relapse. And I love to see this with clients, like, it's learning, right? If you come to me and tell me you had a slip, or you had a lapse, or you bought a pack of cigarettes, or you bought a new, jewel or whatever, we can learn, we can see what brought you to this. So that's a learning that helps us. That's insurance against the next relapse that can happen, right? Also, what you managed to do, like, you managed to go 2 months without a slip or without a relapse. What brought you to that? Right? So again, it's that shift. It's like almost that solution focus shift. It's moving towards, how can we learn from this? How can we recognize what brought you? How did you go 2 months without a slip, right? Instead of like, oh, I only lasted 2 months. Yes, but you used to smoke every day. So how did you go 2 months without it, right? So both of those shifts can also be really helpful for clients. And again, it takes time, but relapse is now learned to be a learning opportunity and not something to completely spiral and go fully off of. It just allows us to more so, learn from it. And it, again, becomes a bit more of a slip instead of this catastrophic kind of failing. Rachel, someone said the slides, they can't see the slides. I don't know. Can everyone see the slides or no?
Yeah, can anyone just confirm if they can see the slides? The slides will be sent out at the end of
Okay,
the
perfect.
webinar.
Bonnie, you can see.
But yeah, if I would try leaving and rejoining if you're having some trouble, but it's good to see that most people can see the slides.
Yeah, absolutely, Emily, right? Failures help us to learn. It's a part of being human. And that's a hard one. And, absolutely, even as clinicians, and we know about it, like, no one really likes to fail, right? We all kind of make ourselves, or we all kind of feel bad about it. But again, it's normal. It is not something to fear. It's something that we as a society have labeled as bad, just like we've labeled sad and angry as bad emotions. But it is something, it's a reframe, and it's absolutely things that we can learn. It's also, I always have people who say that rejection is redirection, right? That's also another really great reframe, because if we do get rejected from something, then we feel really bad, we turn it internally. But recognizing that there's something better for us kind of coming out of it, and it's very true, absolutely can be really helpful as well. Yeah, and absolutely, Carla. Compassion helps to interrupt the reinforcement loop. Absolutely, I agree with you. Okay. Thanks, everyone. So, different barriers to self-compassion. So, if you think about our brain, and if you think about patterns and, you know, habits that we have, if someone has, a really familiar or really kind of well traveled neural pathway of self criticism and negative self judgment, going to be hard, right? Going to be really difficult to start to move towards that kindness. It's not impossible. It's absolutely something. This neuroplasticity, our brains can change. So absolutely being able to, you know, connect with this, teach some of this, do some of the strategies, but just recognize that if someone has a very well traveled pathway of self criticism, negative sense of self, negative self talk, going to be a big barrier, going to be a little bit of work. I have many clients who always will say to me, like, this just feels like, I can say this, like, I have no problem saying that to a friend, but I don't feel it really, or I don't feel it about myself, or yeah, I can say this nice thing to me, but I'm just saying it. I don't truly believe it. And yeah, of course, you just say it. You don't really believe it. If you could believe it overnight, we wouldn't be having this conversation, right? So recognize that it is going to be a little bit of work to get there. Another big one is the fear of self-compassion being self-pity or excusing failure. I have this conversation almost every day with my clients about like, well, no, now I'm just like, I'm coddling myself, or I'm just being too nice to myself, or, I'm just making excuses for mediocrity. No, like we don't have to like beat ourselves down because of something, right? So I always find, especially with that perfectionism personality, a lot of people are really, really tough on themselves. And so there is this almost fear of, if I go too easy on myself, then I'm going to fail anyways, right? I can't hold myself up to this high standard. If I lower my standards, it's going to be bad for me. Also, having unsupportive social environments can also be a big barrier. The other one, we've kind of addressed this, but over identification with relapse, right? So look at that language. I am a failure, or like versus I experienced a setback. So a big one that I like, even a small one, is just being aware of our own language. So being aware of how we describe things, how we talk about things with clients. And I'm a big believer in, like, even if you're having a client who is using negative self-talk, how do we correct that? Even from the first one or two sessions, how do we start to correct that? How do we start to reframe that or look at that differently? And also modeling that with our own, how we're describing, the cessation process, how we're describing relapse, how we're describing um, relapse in general. And so allowing, like, modeling that with our own conversation. Another question that came up, and again was submitted earlier, was a question about lung cancer diagnoses. And so when clients have a diagnosis of lung cancer, sometimes they recognize that stigma is really high, whether, if they are still smoking, or also if they are just because they kind of caused this, let's say, right? There is that stigma with it. So I did include a link to the American Lung Association guidelines about stigma and lung cancer, but I wanted to include these two things because, again, it's one of those reframes. It's one of those, how do we reword the question? So one was, when I became addicted to cigarettes at a young age, I never imagined I would end up with lung cancer. Instead of, I knew I shouldn't have started a bad habit, which I find downplays the incredible, powerful nature of addiction. And then the other one is, I knew I had an increased risk because I smoked, but nothing prepared me for actually hearing those words. Instead of, I know smoking is bad and that it caused my lung cancer, but it was still hard to receive the diagnosis. There's a big self-blame in both of them. It also, again, labels something as really negative, which therefore, this is just screaming of, like, I know something is bad and it caused this. You're putting so much blame on yourself, right? And that is something that we see with a lot of language. And so language is a big one, especially as clinicians. We want to be aware of our language and also always lead with compassionate language, self-compassionate language, but also compassionate language for our clients as well. Just taking a chat. Don't let failure define. Absolutely. Don't let failure define you. Mm. Yeah, thank you so much in the chat. I was diagnosed with lung cancer and never smoked. This is an also challenge one. Absolutely. I feel like that's the go-to, right? And I think as humans, we generally, unfortunately, as humans, we generally, if we hear something that's really terrible, we want to find a cause for it, right? And so with lung cancer, unfortunately, um, a lot of people will just like that's the go-to, right? Because it's scary. Same with melanoma. My grandfather had melanoma, and always the go-to was, oh, he suntanned a lot. And so, we always want to find a cause with certain things. And unfortunately, there is some causal connection, but it's not absolutely, it's not one equals the others. There's many people who have not smoked a day in their life that have been diagnosed with lung cancer, right? Same with melanoma. There's some people that have never set foot in the sun and they still develop melanoma. And so, it doesn't necessarily mean that, but I think as humans, it's just become such a go-to to try and find a cause for something. A couple other activities that I wanted to share. But as clinicians, like I said before, this is this is human stuff. This is not client stuff. This is stuff that we have to do for ourselves as well. So I just wanted to share. There's a link for our own self-compassion scale. So it's Kristen Neff, who is a phenomenal. She kind of created the mindful self-compassion program, and a lot of her work is phenomenal. But I included a link to understand our own. So it's a screener, it's an assessment for our own level of self-compassion. So always great. I don't know if anyone else loves it, but I'm such a big fan of assessments and assessing myself. So, being able to recognize, like, see what your score is, then maybe engage in some self-compassionate practices. And then you can then you know, test it in a month or two and see if it's changed at all. I've also included a link to, I think, I think I lost a bullet point there. So bear with me. I think we lost one. So I'm just gonna see exactly what it is.
Sorry, it was
Yes,
the
loving.
10-minute loving kindness meditation.
Yes, it's a loving kindness meditation. So loving kindness meditation is a really, really big meditation for self-compassion. So it's getting yourself into your body, it's recognizing your emotions, it's connecting with yourself, and then it's starting to send love to yourself. What's nice about loving kindness is you first off by sending love to yourself, like someone that you really love or something that you really love. So you envision someone or something that you very much love. Then you send it to your someone that you find difficult in your life. You send it to yourself, and then you send it to the whole world. And loving kindness meditations have been shown to increase empathy in human beings and increase self-confidence and well-being, and also a sense of connection. So loving kindness, I talked a lot about it during COVID when a lot of people were feeling very isolated, because it does build that sense of connection in people, because you are identifying and connecting with the humanity of other people. And so I've included a link here. There's tons of different loving kindness meditations you can get online, but here's a great one on YouTube. So I encourage you, it's a 10-minute one. And then also just practicing what we preach. So, engaging in our own self care, which also really builds our resilience, exploring our emotions, surfing any critical thoughts, and then also CBT techniques, especially if you are a CBT clinician, being able to challenge our own negative thoughts, being able to challenge our own, self critical thoughts is also a really big one. I also really love the compassionate colors activity. So what you're going to be doing is, it's a bit of a mindful activity, but you're just starting with some like really good breath. So breathing in, breathing out, just kind of imagining the breath to be a little bit rhythmic. So just kind of get into a flow with your in breath and your out breath. And what you do is you imagine a color that you associate with compassion, kindness, or warmth. There's no rules. It's just your own kind of identification of what you identify, what color reminds you of compassion. And then what you do is you imagine it surrounding you. You imagine it entering through your chest, your heart, spreading through every inch of your body. And then you move to this color. So as you focus, it's building on you. You then focus the colors one of wisdom, strength, warmth, and kindness. And you create a facial expression to match the feeling of the color and to make sure to keep that expression on your face as you practice it. So whatever your facial expression is that matches the feeling of kindness, warmth, wisdom, strength, compassion, keep that on your face. And then really, again, visualizing that color flowing through you, focus on the feeling that the color's sole purpose is to help you, strengthen you, support you, and then allow yourself to really feel supported and loved. And I really liked that one because, again, it's a great visualization. I love doing that with children. I find children really, really like that. And it's a good one to just kind of feel that visual embodiment of what it feels like to go through you. So I really like that with clients as well. It's called the Compassionate Colors activity. You can find stuff online on how to do it, or if you want a script to work with your clients, absolutely. I recommend trying it out. Yeah, Christine, I love that. Don't use labels like smoker. Absolutely, right? That's something that started with mental health, right? We would stop, we moved away from labeling people as their mental health issue. And absolutely, I think we don't want to be using smoker, as well with that, because again, there's so much more to, Bob who smokes instead of Bob the smoker, right? So different strategies to foster self-compassion, right? So couple different ones that I really love. So when we're working on relapse prevention plans is, again, absolutely you want to include it. So depending on your clinical what it looks like with clients, like, are you seeing people throughout? Do you only see them at, checkpoints, whatever it is? But part of relapse prevention plans could be talking about, again, relapse is an expectation, not an exception. And then how are we going to respond to it? Relapse can bring up these feelings. They're feelings, they're not facts, but how do we bring them, like, how do we respond to it? So that's like, how would you talk to a friend, right? Would you respond to a friend? And I always like to say that, like, to a client, if they're saying something, be like, okay, so like if your friend was going through this, right? And like name everything that they're going through, I would describe it. Be like, and they said to you, like, you know what, Stephanie, this was really, really tough. Like I screwed up really bad. What would you say to your friend, right? How would you say it to your friend? Would you ask them any questions? How would you show them that you cared? So what would you do to that friend, right? Or how would you respond to that friend? And then we shifted to, okay, so we're in this situation. How do you now talk to yourself as if you're the friend? How do you treat your thoughts? How do you treat your emotions? What tone do you use to respond to yourself? Right? So, reframing that as it's the relationship question. How would you treat a friend? And, many people recognize that we generally don't treat ourselves quite as nice as we treat our friends, but it's a great one to reframe right in the moment. Rephrasing inner criticism is also a really big one. So, when we are having those not nice critical thoughts, is recognizing, how do we take what they're saying, but how do we reframe it or rephrase it with a more compassionate voice? How do we rephrase it with a more positive tone instead of that kind of like harsh, unsupportive, negative voice? So again, criticisms, they're coming. Like we're criticizing ourselves because we really want that, right? We really do want to quit smoking or cut down on tobacco. And so we absolutely do want that. And so the criticism is coming out of something that's like our body telling us we really want this thing. It's something that's very meaningful to us. So it's not all negative. It's not all terrible that, it's coming out of something. There is some truth to it, but it's how it's being delivered. So how do we rephrase that is recognizing, you know what? Quitting smoking or stopping tobacco is really, really important to me. And it's disappointing and I'm upset that I had a slip, but I'm going to learn from it instead of, beating myself down. So, doing some of this preempting relapse by preempting the relapse spiral by including some of these activities in your relapse prevention plans. The other one is encouraging regular mindfulness and self-kindness exercises. So again, the loving kindness meditation, any mindfulness practice around triggers. So being aware. I always say to people, like, approach your trigger with a curiosity, right? So often we are told to push those triggers away, push those emotions away. What does it look like if we approach them with a curiosity? Right? What is it telling us? What are we hearing? What are we feeling? So that bit of that mindfulness practice with it. The safe activity is also another really great one. So essentially what you would do is, so it means it's soften, allow, feel, and expand. So soften is easing into the emotion, taking a deep breath, recognizing its presence. What emotion are you feeling? Where is its strongest presence within your body? Allow is giving the emotion permission to exist. Inhale and exhale, acknowledge the emotion without resistance or attachment. Simply allow it to be present. Feel, attend to the emotion with kindness and discover your needs. Investigate the feeling. How does it shape your self image? What is the emotion telling you at this moment? And expand is extend your consciousness to include all individuals who experience such emotions. Every human being makes mistakes and experiences suffering. Your experience is not unique to you. Deeply take in this notion and embrace it. So soften, allow, feel, and expand. So again, allowing is just allowing the emotion to exist. Feeling is feeling it. And then expanding is, again, expanding out. You're not alone in this, right? You're not alone. You're not the only person who's lapsed or relapsed. This is not unique to you. So that, again, going back to that common humanity piece. Fostering community and support and group therapy is also a really great one to reinforce common humanity. And then I also really like with clients to develop personalized self-compassion rituals. So are there daily affirmations? There's a lot of literature around daily affirmations. Journaling is also a really great one. So you can journal. I always love with clients to journal. Like gratitude journaling is a really, really great tool. There's a lot of literature behind that for mood in general. I also really like people to journal. What's one thing you did well today? What's one thing that you did well today? Because what it does is how often at night we get into bed and we think, oh, I didn't like, I screwed that up, or I did that bad, or replaying something that was embarrassing to us, or we think about all the things that we didn't get done. Well, how do we rephrase it? It's like, what did you do well today? Right? Like one thing that you did well today. Because you get in the habit of writing it down every night, the other thing you have to, what it does is it forces you to now look for things that you accomplish, look for things that you did well. And so I really like that one as a consistent, because again, it's that consistent building of recognizing your worth. And then identifying what you want is, again, very similar to kind of like recognizing that criticism isn't a motivator, but it also is, it's highlighting something that we want for ourselves, right? So it's recognizing if we think about a goal that we really want, instead of thinking about how critical our language generally is and how criticism makes us feel, we then flip the language and we write down words or phrases that make us feel really motivated. And then, when clients then catch themselves with being critical or overly judgmental, we reflect back and amend that thinking or rephrase that thinking to be more compassionate and motivating. I can send all of these exercises in the email as well, so you can have them and you can work with them with your clients as well. If we look at age, there's no differences in activities for these age. You can just tailor it with references for your clients. And then just in general, if you do work with youth, because I do, so I have a particular interest with working with youth, there's a lot of evidence for mindful self-compassion and its impact on mental health. And so there's a link there too, which has tons of activities and just the literature in general on mindful self-compassion and things that we can work with youth. But again, it's for youth, but you can do it with anyone. These are great. Cool. Any questions? I know. Sorry, I went a little bit long. I always tend to go long. I apologize.
No, it's okay. You feel like you took a lot of questions throughout too,
Okay, great.
which was definitely helpful. But we do have time if there's like one or two questions, um, we can take these as well.
So Carla, I'm not going to be including some compassion. Did you mean phases or phrases?
Maybe
Shake,
phrase.
self-compassion exercises in group counseling. I love the I love the loving kindness. I love the identify what you want, and I love the safe activity in a group format. How would you treat a friend is also good. You can pair up and have people do it in pairs. This stuff works really well in a group format. Phrases. Yeah. So self-compassion phrases, what's interesting is I actually don't love to give them to people because I like when clients come up with them themselves because I find that it's more meaningful to them, right? So something that I would say to myself is maybe not what would be meaningful to somebody else. So I like to use it to do a bit of a brainstorm and have people come up with some phrases themselves. You can give them a little bit of a hint or, starting off point, but I find that they're more meaningful if people come up with them themselves. Same with affirmations. Yes, absolutely, Ephraim. I would bring this idea prior to a client's clinic, like a beginning conversation, normalize relapse.
There's one more. Go
Yes, I'm
right ahead.
just trying to see this. Oh, there's two. How do you approach, Natalie, using self-compassion with someone whose core belief is that they're not worthy or lovable? It's a tough one. It's a tough one. So, they probably should start working on some core belief stuff, number one, but that's besides the point. Um, Even though they recognize themselves as not worthy or lovable, if they're working on something, so let's say if it's like if it's tobacco cessation, then it's still relapse is still, and like failures, like those are feelings. Relapse is still the expectation. It's the norm, right? So you don't have to be lovable to still succeed at your goals, kind of, right? So I hope that makes sense. The other one is starting to really use some of these compassion activities will then start to work on some of those core beliefs as well. So, have them do a loving kindness meditation, have them start to really surf the emotions, have them connect with the emotions, have them, the treat the friend activity. All of those are really, really good because it will hit whatever you're working on them with, but then also would really hit some of the core belief stuff as well, because that's what you would do with core beliefs. Emily, barriers to self-compassion slide where there's stigmatized thoughts with lung cancer. Can you give another example of how you reframe that with clients? Yeah, I would just, again, so depends on the client. Sometimes I would do I would take a bit of a CBT approach. So I would, if there is a lot of self-stigmatizing, being like, I caused this, I would look at the evidence for and the evidence against that. Like, what are the facts behind that? What's the evidence behind that? Like, no one deserves to get cancer. You didn't cause this. There's so many other causes or so many other risk factors. So I would take either a CBT approach to it. And then with other clients, again, depending on the relationship with the client, I would I would just explore the emotions with them. I would take some time, surf the emotions with them, and then, be like, okay, well, how do we start to treat ourselves? Like, again, would you say this to a friend that was, that smoked and got lung cancer? What would you say to a friend? You would never say any of this to a friend. So how do we start to talk to ourselves as a friend? Because, you're going to be going to a battle, right? Like you're fighting the cancer now. We have an enemy now. And so, you know, you you need to be nice to yourself for this fight. So I do a little bit of talk around that. Thank you everyone so much. I will continue to answer questions if there's some correlations between lack of self-compassion and substance use or smoking. There is correlations between lack of self-compassion and just low mental health and substance use and just kind of any maladaptive coping. So absolutely, you do see that because there's low resilience also, like low self-compassion leads to low resilience, which leads to, maladaptive coping, which is generally substance use and smoking, low mental health as a result. So absolutely, there are correlations with that. Thank you. Thank you so much, everyone. It was such a nice time spent together. Thank you so much for your engagement and for chatting with me. That's my email, so feel free to send me an email. I love to talk about this stuff. I love friends, so please feel free to reach out, send me an email, and I will send the exercises and activities over so you can get all of them.
And thank you, Steph. Honestly, you can see this has resonated for a lot of people, and I even feel like I've learned so much from just an hour period. So
Thank
thank you
you.
for coming today, and thank you. You've been so engaging and taking the time to answer everyone's questions too.
Oh, thank you so much. Thanks, everyone. I hope you have a wonderful long weekend.
I'm just gonna wrap up with like a couple end of webinar reminders, but honestly, if anyone at this point has to go, I know it's a lot of people's lunch hour. Please feel free to. Again, thank you, Steph, for joining us today. This is just a reminder that we will send the evaluation and post-learning assessment through email to everyone who has registered by the end of the day. And you'll have a week to complete that, which would be May 21st, in order to receive a letter of completion. And our next month, our Teach Educational Rounds will be a vaping Q&A with Dr. Milind Kara and Dr. Peter Selby from our Intrepid Lab. And that will be on a Monday next month, as opposed to our usual Wednesday Teach Educational Rounds. This will be Monday, June 23rd from 12 to 1 p.m. still. So registration will be opening soon for that. And you'll also have the chance to submit questions ahead of time. And in case you want to, review this webinar again or see any of our previous webinars, we do have an archive list on our website that is accessible to everyone. That's it. Thank you. Thanks again, everyone, for attending. And thanks again, Steph. This was great. And everyone, enjoy your long weekend.
Thank you so much, everyone. Have a great weekend.